Cardiologist warns. This pill is damaging the hearts of older adults. As we journey through life, particularly after reaching the age of 60, safeguarding our cardiovascular health transitions from a recommendation to an absolute necessity. Yet, it's a sobering reality that the most significant threats to our hearts may not stem from our dietary choices, our stress levels, or even our genetic predispositions, but rather from unassuming items quietly residing in our medicine cabinets. Leading cardiologists are now issuing a stark warning, not about obscure illnesses or complex surgical interventions, but about the commonplace medications that a considerable number of older adults consume daily, often without a full appreciation of the inherent risks. We are speaking of pharmaceutical products that have received FDA approval, are prescribed by physicians, and are widely utilized. However, within the aging physiology, these very medications can insidiously elevate the likelihood of experiencing heart failure, a stroke, or even sudden cardiac arrest. The most concerning aspect of this unfolding situation is that the vast majority of seniors are never adequately informed of these potential dangers. Prescriptions are frequently renewed automatically. Side effects are casually attributed to the natural process of aging, and the perilous interactions between different medications are far too often overlooked. But this prevailing ignorance is precisely what this important discussion aims to change. In this informative presentation, we will meticulously count down 5 specific pills that, particularly for individuals over the age of 60, can pose a significant threat to their heart health. While some of these medications might be familiar to you, others may come as a surprise, but every single one of them warrants a thorough reevaluation of its role in your health regimen. This discourse is not intended to incite fear. Rather, it is founded upon verifiable facts, supported by rigorous research, endorsed by trusted experts, and explained in clear, accessible language. If you are over 60 years of age, or if you are concerned about someone who is, pay close attention, because the knowledge you are about to acquire could be instrumental in protecting your heart, preserving your independence, and perhaps even saving your life. Let us commence our exploration with the 5th item on our list. It is a medication found in nearly every household and possesses the potential to silently increase your risk of heart failure, chronic fatigue, and long-term damage to your cardiovascular system. Number 5. Ibuprofen and NSAIDs, the hidden strain on aging hearts. Ibuprofen, naproxen, diclofenac. These familiar names represent a class of pain relievers that are virtually ubiquitous in modern homes. They are widely trusted, easily recognizable, and readily available. When pain arises, whether from the stiffness of arthritis, a persistent backache, or a nagging headache, most individuals will reach for one of these pills without a second thought. However, once we cross the threshold of 60 years, these commonplace medications can subtly transform into a significant cardiac hazard. Non-steroidal anti-inflammatory drugs, or NSAIDs, perform a function beyond merely alleviating pain. They also influence the way our kidneys manage the delicate balance of salt and water within our bodies. In younger individuals, the body possesses a remarkable ability to compensate and adjust to these physiological shifts. Yet, as we age, the inherent efficiency of our kidneys naturally diminishes, even if laboratory tests continue to present seemingly normal results. This age-related decline in kidney function means that our bodies may begin to retain an excess of fluid. You might start to notice subtle signs such as swelling in your ankles, a feeling of tightness in your shoes, or a general heaviness in your legs. You might also find yourself feeling more fatigued as the day progresses. These symptoms are frequently and mistakenly dismissed as mere consequences of aging. However, in a significant number of cases, they serve as crucial warning signals. The retention of fluid places an additional burden on the heart, compelling it to work harder. For older adults, especially those who already contend with high blood pressure or have a pre-existing history of heart disease, this augmented pressure can exacerbate existing heart failure or precipitate dangerous fluctuations in blood pressure. The potential risks associated with NSAIDs do not cease with fluid retention. These medications have also been shown to reduce blood flow to the kidneys, thereby further compromising their function over time. Their use has been correlated with elevated blood pressure, kidney damage, and even a heightened risk of heart attack and stroke. Furthermore, the duration of NSAID use directly amplifies these risks. The longer you are exposed to them, the more pronounced the potential negative consequences become. It is critical to understand that even short-term usage can be problematic, particularly when these drugs are taken concurrently with other medications, such as diuretics or ACE inhibitors. This combination can create a perilous trio, capable of severely impairing kidney function and significantly increasing cardiac strain. What renders this entire scenario so insidious is the subtle nature of its onset. You are unlikely to feel your kidneys struggling under the strain, nor will you directly perceive your heart working overtime. The symptoms manifest quietly as mild swelling, fatigue, or occasional dizziness, sensations that are easily attributed to the general process of aging. Moreover, because NSAIDs are readily available over the counter, they often do not carry the perception of being serious medications. Yet, it is precisely this perception of harmlessness that contributes to their underlying risk. If you are currently using NSAIDs on a regular basis and have passed the age of 60, it is imperative that you engage in a conversation with your physician to determine whether these medications remain the optimal choice for your health needs. It may not be necessary to discontinue them entirely. However, employing them only on an occasional basis, rather than daily, can make a substantial difference in mitigating potential risks. Depending on your specific requirements, safer alternatives might include acetaminophen for certain types of pain, or topical treatments that exert minimal to no impact on the heart or kidneys. Additionally, lifestyle-oriented approaches, such as regular stretching, the application of heat therapy, or engaging in physical therapy, can prove highly effective in managing chronic discomfort without resorting to systemic medications. The overarching objective here is not to advocate for enduring pain in silence, but rather to find effective methods of pain relief that do not inadvertently introduce more significant health complications. For older adults, NSAIDs may appear innocuous, but they may be silently jeopardizing the well-being of your heart. Now, let us transition our focus to the fourth item on our list. This is not a medication primarily designed to combat pain, nor is it intended for issues related to your joints or back. Instead, it is a class of drugs often prescribed to facilitate sleep or to alleviate feelings of anxiety. However, for individuals in their senior years, these medications may be insidiously eroding their mental clarity, their physical balance, and ultimately, their cherished independence. Number 4, benzodiazepines, the sleep aid that can steal your stability. If you have ever experienced difficulties falling asleep, staying asleep throughout the night, or found yourself grappling with racing thoughts and anxious rumination, your physician may have prescribed a medication from the benzodiazepine class, such as lorazepam, temazepam, or diazepam. For a great many older adults, these medications often feel like a genuine lifeline. They offer the promise of a full night's sleep, a reduction in unsettling anxiety, and a return to a sense of normalcy. But what if these very same medications were also quietly increasing your susceptibility to falls, episodes of confusion, or even contributing to long-term cognitive decline? Benzodiazepines function by dampening the activity within the brain and the broader nervous system. This mechanism is precisely what contributes to their calming, sleep-inducing, and anxiety-reducing effects. However, in the physiology of older adults, this dampening effect can unfortunately extend too far. These medications do not merely induce relaxation in the brain, they also demonstrably slow down reaction times, impair muscle control, and compromise balance. This trifecta of effects significantly elevates the risk of falls, particularly during the nighttime hours when grogginess is often at its peak. It is vital to recognize that falls in this age group are far from non-trivial incidents. They represent one of the leading causes of serious injury, hospitalization, and the devastating loss of independence among seniors. The dangers associated with benzodiazepines, however, extend beyond the immediate risk of falls. They have also been linked to notable memory impairments, a pervasive sense of mental fog, and, in cases of long-term usage, an increased risk of developing dementia. What may initially present as mild forgetfulness or a subtle difficulty in concentration can, over time, gradually progress. Tragically, most individuals affected by these issues never connect their symptoms back to the medication they are taking. Compounding these concerns is the issue of dependence. The body tends to adapt to benzodiazepines over time, meaning that you may require increasingly higher doses to achieve the same therapeutic effect. Furthermore, abruptly discontinuing these medications can trigger a withdrawal syndrome, characterized by symptoms such as heightened anxiety, insomnia, restlessness, and even tremors. This can lead to a cyclical pattern. You may feel you need the pill to sleep, yet the pill itself may be slowly undermining the very clarity and stability that a good night's sleep is intended to support. So, what is the recommended course of action? Firstly, it is crucial to avoid panic, and under no circumstances should you cease taking the medication abruptly, as this can be dangerous. If you are currently taking a benzodiazepine, the most important step is to have an open and honest conversation with your doctor. They may suggest a gradual, medically supervised tapering off the medication or explore alternative treatments that do not carry the same spectrum of risks. Fortunately, there are effective non-pharmacological therapies available. Cognitive behavioral therapy for insomnia, CBTI, is recognized as one of the most potent treatments for chronic sleep disturbances, and importantly, it does not come with any associated side effects. For anxiety, a range of approaches can be beneficial, including mindfulness practices, specific breathing exercises, engaging in light physical activity, or even certain types of antidepressants, all of which can be helpful without posing the same risks to balance and memory. The fundamental principle to grasp is that not every instance of sleep difficulty or anxiety necessitates the use of a sedative. For older adults, what may appear to be a small measure of relief can come at a considerable cost. That unassuming pill intended to lull you into sleep might, in fact, be insidiously diminishing your balance, your awareness, and your overall independence. If you have found this video to be beneficial thus far, we encourage you to take a moment to like this video, subscribe to our channel, and activate the notification bell so that you do not miss out on any future uploads. Moving on now to our third point. Number 3, proton pump inhibitors, the silent drain on your heart and body, heartburn, acid reflux, indigestion. These are common complaints that tend to increase as we age. For a great many individuals experiencing these symptoms, the solution presents itself in the form of a small pill. Medications like omeprazole, pantoprazole, and esomeprazole, collectively known as proton pump inhibitors, PPIs, are designed to significantly reduce the production of stomach acid. While they can offer profound relief from the discomfort of a burning chest, a persistent sour taste, or post-meal pain, their long-term implications, especially for older adults, are often understated. The critical point that many individuals fail to grasp is that these powerful medications were never intended for chronic, long-term use, particularly in the aging population. Millions of seniors rely on PPIs daily, often for months or even years, without reevaluating whether their continued use is truly necessary. This seemingly innocuous daily routine, however, can lead to serious health consequences over time, some of which directly impact the heart, bone density, and overall physical resilience. One of the most frequently overlooked consequences of PPI usage is their interference with the absorption of essential nutrients. Stomach acid plays plays a vital role beyond merely causing discomfort. It is instrumental in helping the body absorb key minerals such as calcium, magnesium, and iron. When stomach acid levels are suppressed for extended periods, these crucial nutrients are not absorbed as efficiently as they should be. A deficiency in calcium, for example, can lead to weakened bones. In older adults, this translates directly into an increased risk of fractures, most notably debilitating hip fractures, which can profoundly alter an individual's quality of life. The impact, however, does not stop with skeletal health. Magnesium deficiency, a condition more commonly observed in long-term PPI users, can disrupt the heart's natural rhythm, lead to painful muscle cramps, and contribute to feelings of dizziness and fatigue. Similarly, insufficient levels of iron and vitamin B12 can result in anemia, nerve-related problems, or cognitive clouding. All of these issues can easily be mistaken for the natural effects of aging, when in reality, they may be directly linked to medication use. Furthermore, the immune system also plays a role. Stomach acid acts as a natural defense mechanism, helping to protect the body from harmful bacteria ingested with food. With significantly reduced acid levels, the body becomes more vulnerable to infections, particularly Clostridioides difficile C. diff, a severe gastrointestinal infection that can cause significant diarrhea and dehydration, posing a particularly grave threat to older adults. Some research has also indicated a potential link between long-term PPI use and an elevated risk of kidney disease, dementia, and cardiovascular problems, although further extensive research is still ongoing in these specific areas. Nevertheless, the overarching pattern is becoming increasingly clear. The longer these medications are taken without a reassessment of their necessity, the more the potential risks begin to outweigh any perceived benefits. This is not to suggest that PPIs are inherently detrimental medications. They are in fact highly effective and often medically necessary, especially in the treatment of active ulcers, esophagitis, or certain other gastrointestinal conditions. However, what should ideally be a temporary course of treatment frequently evolves into a perpetual habit. If you have been taking a PPI for a period exceeding a few months, it is strongly advisable to consult with your physician. It is possible that you still require the medication, or it may be that you no longer do. In some instances, a transition to lower doses might be appropriate, or the medication could be taken only during symptomatic flare-ups or tapered off entirely under medical supervision. The critical takeaway is that relief sought today should not come at the expense of your future strength, your physical stability, and your overall resilience. Now, let us advance to our second point. This is a medication that is intended to provide protection for your heart, but in instances where the dosage is incorrect or when combined with other drugs, it can paradoxically place your heart in a perilous state. Number 2, heart and blood pressure medications, when the cure becomes the risk. When we contemplate medications that might potentially harm the heart, drugs prescribed for blood pressure typically do not immediately come to mind. In fact, their very purpose is to safeguard the cardiovascular system by lowering elevated pressure, reducing strain on the heart, and enabling it to function more efficiently. For millions of older adults, these medications are not merely beneficial, they are absolutely essential for maintaining health. However, there exists a less comfortable yet undeniable truth. The very medications prescribed to protect your heart can, under certain circumstances, actually put it at risk. This is particularly true if the prescribed dosage is too high, if the combination of medications is overly complex, or if the body's physiological state has significantly changed since the prescription was initially issued. Let us begin with diuretics, commonly referred to as water pills. These medications work by assisting the body in eliminating excess fluid and salt. They are frequently employed in the management of high blood pressure and heart failure. Yet, in older adults, their use can lead to dehydration, a depletion of potassium, imbalances in sodium levels, and a prevalent sense of dizziness. That persistent feeling of tiredness and lightheadedness experienced upon standing may not be attributable to aging alone. It could very well be a consequence of your diuretic medication excessively depleting your system. Next, Consider calcium channel blockers, a class of drugs that function by relaxing blood vessels, thereby reducing blood pressure. However, in some senior individuals, these medications can trigger swelling in the legs and ankles, cause an overly slow heart rate, or contribute to feelings of fatigue and mental fog. Beta blockers, another widespread category of cardiac medication, can present their own set of complications. While they are effective in slowing the heart rate, which is beneficial, this effect can sometimes become excessive. This can manifest as shortness of breath, cold extremities, and a diminished capacity for physical exertion. In individuals with diabetes, beta blockers possess the additional risk of masking the subtle signs of dangerously low blood sugar, thereby creating a hidden and potentially serious danger. The reality is that the human body undergoes profound transformations with age. Blood vessels naturally stiffen, the filtering capacity of the kidneys slows down, and the body's ability to regulate salt, water, and blood pressure undergoes significant shifts. Consequently, a dosage that was perfectly appropriate and effective at age 55 may now be excessively potent and potentially harmful at age 75. The issue is not confined to single medications. Many older adults are concurrently prescribed multiple heart medications. This might include a beta blocker, a diuretic, a drug to regulate heart rhythm, and another to manage cholesterol levels. The synergistic effect of these combined medications can quietly overwhelm the body's systems. This phenomenon, known as polypharmacy, is remarkably prevalent among seniors. Often, one medication is prescribed to counteract the side effects of another, creating a cascading effect. Before long, the individual's body is attempting to manage a complex regimen of 6 or even 7 different prescriptions simultaneously. When this occurs, individuals may begin to feel unwell, experiencing cognitive fogginess, weakness, or a loss of steadiness on their feet. While these symptoms are frequently attributed to the natural process of aging, in many instances, they are, in fact, a direct result of medication overload. When cardiac medications begin to negatively impact balance, kidney function, or overall energy levels, the risk of hospitalization increases, not due to the underlying heart condition itself, but rather because of the way it is being managed through medication. To be absolutely clear, these medications can be life-saving, but it is crucial that they are reassessed regularly rather than simply being refilled out of routine. The ultimate goal is not solely to achieve favorable numbers on a medical chart. The true objective is to empower you to remain sharp, stable, mobile, and independent. If you or someone you care about is over 60 years of age and is taking multiple medications for blood pressure or heart disease, it is essential to ask, are the current dosages still appropriate? Are these medications working in concert, or are they potentially counteracting each other? Because while the right heart medication can be a life-saving intervention, an incorrect combination can insidiously diminish your life piece by piece. And now we arrive at number 1. Arguably the most perilous pill of all. Its danger does not lie in its individual identity, but rather in the sheer quantity you might be consuming. Number 1, polypharmacy. The most dangerous pill is all of them. If there is a single factor that poses the most significant threat to the well-being of older adults, it is not a solitary pill, but rather the amalgamation of multiple medications. Polypharmacy, defined as the simultaneous use of 5 or more medications, has regrettably become one of the most dangerous and frequently overlooked threats to senior health. Its prevalence is astonishing. Studies indicate that nearly half of all adults over the age of 65 take 5 or more medications on a daily basis, and many consume far more than that. This can include a pill for blood pressure, another for cholesterol, something to aid sleep, a pain reliever, an acid reducer, a vitamin supplement, and perhaps a mood stabilizer. One prescription often leads to another, and then another, until the body is tasked with managing a complex and intricate mixture of drugs that have, in many cases, never been rigorously tested together, especially within the context of aging physiology. Here is a crucial piece of information that many individuals are never privy to. Every additional medication introduced into the regimen increases the probability of experiencing side effects. Furthermore, each new combination elevates the risk of potentially harmful drug interactions. With every extra pill, the burden on the kidneys, the liver, and the heart intensifies. The consequences of this excessive medication load are not always dramatic or immediately apparent. They are often subtle. You might find yourself feeling more tired, experiencing a loss of steadiness, noticing a decline in memory, or observing a slowing of your digestive processes. Your mood might also shift. While many individuals attribute these changes to the natural aging process, it is imperative to recognize that, in some instances, these are direct repercussions of the medications being taken. Perhaps the most troubling aspect of polypharmacy is that a significant portion of these prescribed medications are no longer medically necessary. They may have been initially prescribed months or even years ago and have never been subsequently reevaluated. In some cases, the original condition for which the medication was intended may have resolved or improved, or the side effect of one drug might be erroneously treated with yet another medication. This creates a quiet, insidious spiral, not towards improved health, but towards increasing fatigue, physical frailty, and a growing dependence. Polypharmacy does not merely impose strain on the heart, it can systematically diminish your mental acuity, your physical energy, and your cherished independence. The solution is not to abruptly discontinue all medications. Instead, the necessary approach involves a comprehensive review of every medication currently being taken. A skilled physician or pharmacist can meticulously guide you through your current list of prescriptions, identify any outdated or unnecessary medications, reduce the number of drugs where possible, and adjust the dosages of those that remain essential. The potential benefits of such a review can be profoundly life-changing. You might experience a reduction in dizziness, a resurgence of energy, improved focus and concentration, a clearer mind, fewer falls, a decrease in hospital visits, and, in some cases, a return to feeling like your true self again, perhaps for the first time in many years. Health is not always about accumulating more interventions. Sometimes it is about thoughtfully letting go of that which no longer serves your well-being. If you or someone you love is currently taking 5 or more medications, do not delay. Schedule a medication review appointment. Do not hesitate to ask the challenging questions. And, crucially, do not be afraid to be your own advocate, because the most dangerous pill might very well be the one you have unconsciously continued to take without realizing its potential impact. If you have found this video to be informative and helpful, please consider giving it a like and subscribing to our channel so you don't miss out on future health insights as we explore and break down health topics like this every single week. In the comments section below, we invite you to share how many medications you or a loved one are currently taking. Have you ever questioned whether they are still truly necessary? Your shared experience could offer invaluable assistance to someone else. And remember, sharing this video with a friend or family member could be a vital first step in protecting their health and well-being.